here's a real softball for you. Ready? It's coming right down the middle of the plate.
Okay.
Has the increase in healthcare spending in recent years resulted in directly proportional improvement in patient outcomes?
I'm not.
If you don't know, guess. I mean,
I'm not convinced that I have. I mean, we have seen some data to suggest that the prevalence of heart disease has diminished. The mortality rates with heart disease have diminished a bit, and it went from the #1 to now the #2 after cancer in terms of the highest rate of mortality in this country. So we've seen some modest improvements, but working in a managed care environment and can validate this. We are inundated now with an aging population and this growing, tsunami of chronic disease coming down the pike, with diabetes kind of leading that charge, growing at, 9–10% a year. That I'm concerned that we aren't there yet. We're not, the additional spending that we are putting forth in these populations, I'm not convinced has direct proportionality.
There's a hidden hook in the question, which is maybe we're getting some sort of decrease in some of these conditions as a result of spending, but is it the spending that's causing it?
I don't know that I have an answer. I can answer your question.
Please do.
We are not getting a directly proportional, and that's the key. I think we are seeing improvements. But is it directly proportional to the amount of money that we're pouring into this? No, there are a lot of reasons for that too. Some of it stems from the fact that new efforts are being made to bring drugs to market, and those new drugs are expensive. And the price of those drugs keeps going up. And we have, again, another example of a healthcare misalignment. We have pharmaceutical manufacturers who's doing their job. They're bringing these drugs to market to help with a condition, but they also have they're private companies. They have to meet the needs of their investors, which means that they have to get a return on their investment. And in a system where people feel there's some truths to healthcare. One is healthcare is a right in this country. People believe that they are entitled to healthcare. Two, healthcare is expensive in this country. Three, there's somewhere between 46 and 50 million uninsured patients in this country. And four, we aren't getting the value for our dollars that we're spending.
So again, if we are talking on averages, you're absolutely correct. But people are not averages. I mean, you don't have 2.3 kids. I mean, it doesn't work that way.
I do.
I can tell. Well, but you're from Utah, right?
That's right. We're allowed to have 0.3 kids.
And once again, we're going to stop right there.
Yeah, but the point that I want to bring up is that for my patients, where I, for many years, could actually have them afford that very expensive drugs and could understand giving them what you call polypharmacy, I was not so good for the hospital because the amount of my patients being admitted to the hospital dropped down by over 90%. The amount of my patients getting open heart surgery actually almost disappeared. The amount of my patients getting angioplasty, not there, so the hospital.
You were killing your hospital.
I was. They did not make money, but where was I expensive? I was expensive for the insurance company because I used those expensive drugs. So I think that, yes, I want people that invent something to make money. I mean, that's not what Apple did? They invented an iPhone and they make money. And they will continue to invent to make more money. If you don't allow it for the pharmaceutical company to do, because you say, oh, they have to give for the 56 million people they don't have. I think we have an issue. And I think that we probably will eventually have to find two-tier system in this country if we want to preserve some good medical care.
We already have a two-tier system in this